Welcome to another deep dive. We're going to be talking about something that's super important for all pilots, and that's aeromedical factors. You sent over a whole bunch of material on this, which we really appreciate. So the goal today is to break it all down and make sure you have all the essential info you need to fly safely.
Yeah, and hopefully we can do that without, getting too bogged down in the weeds. I think it's all about understanding the key physical and mental stuff that really matters for flying safely.
Okay, so why don't we start with medical certification? It's pretty clear that for most types of flying, you absolutely need a valid medical certificate.
Right. But I guess it's worth pointing out right away that there are some exceptions to that rule.
Yeah, like glider pilots and free balloon pilots, they don't necessarily need a medical certificate, right?
Yeah, that's right. And even for sport pilots, there's that option to use a driver's license instead of a medical certificate under certain specific circumstances.
And even if you're not required to have a medical certificate, it's still super important to be responsible and self-aware, right?
Yeah.
If you know you have a medical condition that could make it unsafe to fly, you're obligated to not fly, regardless of what the regulations say.
Absolutely. And that's actually spelled out pretty clearly in the FARs in 14 CFR 61.53, to be exact. It basically says that you can't act as a crew member if you know you have a medical condition that would make it unsafe to operate an aircraft. That's kind of a fundamental principle that applies to everyone.
So when you do need a medical certificate, you'll be dealing with an aviation medical examiner, right? An AME.
Right, that's right. AMEs are doctors who have specific training in aviation medicine. They're authorized by the FAA, specifically by the Civil Aerospace Medical Institute, or CMI. They're the ones who will conduct your medical exams and actually issue your medical certificate if you meet the requirements.
So CMI, they're like the big guys, the headquarters for all things aerospace medicine, right? They're the ones setting the standards and making sure everything's up to snuff.
Yeah, exactly. CMI is a really important part of the FAA. They do a lot of research into aerospace medicine, and they're also responsible for training and overseeing the AMEs. They make sure that the medical certification process is rigorous and consistent across the board.
And it seems like there are different levels of medical certification, kind of like tiers. You have your first, second, and third class medical certificates.
Right, exactly. And the class of medical certificate you need depends on the type of flying you're doing. So, most private pilots just need a third-class medical, which has the least stringent requirements. But if you want to be a commercial pilot, you'll need at least a second-class medical. And to fly for an airline, you need a first-class medical, which is the most restrictive one.
And these medical certificates, they don't last forever, do they? There are expiration dates and stuff.
Yeah, for sure. And the validity period for each class of medical certificate is different. Like a third-class medical is valid for 5 years if you're under 40, but only 2 years if you're 40 or older. A second-class medical is always valid for 1 year, no matter how old you are. And a first-class medical is good for 1 year if you're under 40, but only 6 months if you're over 40.
So it's important to keep track of those expiration dates. And what's kind of interesting is that, if you have a higher class medical, it actually covers the privileges of the lower classes. Kind of like how if you have a premium subscription, you get access to all the basic features. But the catch is that the validity period depends on what you're actually doing at the time.
Yeah, that's an important point. So if you have a first-class medical and you're just flying your own plane for fun, you're operating under the privileges of a private pilot. So the longer validity period of the third-class medical applies. But if you decide to do some commercial flying, like say you're giving someone flight instruction, then you're operating under the privileges of a commercial pilot. And that means the 1-year validity period of the second-class medical kicks in.
So what about student pilots who might have some physical disabilities or limitations? Are there any options for them to learn to fly?
Yeah, actually there are. The regulations recognize that, some people might have physical challenges that don't necessarily mean they can't fly safely. So student pilots can actually get medical certificates that are specifically for student pilot privileges only while they're undergoing training. Depending on the specific limitation, they might need special equipment installed in the aircraft, like hand controls, or their certificate might have certain restrictions.
Like not valid for flight requiring the use of radio if they have a hearing impairment. And what about the Statement of Demonstrated Ability, the SODA? That seems like a big deal for pilots with disabilities.
Yeah, the SODA is really important. Basically, if a student pilot with a disability has met all the requirements for training and they can demonstrate that they can fly safely despite their limitation, the FAA can issue a SODA. This basically waives the specific medical standard for that pilot. So it's not just about checking boxes on a medical form. It's about showing that you can actually do the job safely.
That's really encouraging. Okay, so In the material you provided, there's a section that gets pretty specific about medical conditions that are automatically disqualifying. Like, there's a list of 15 conditions based on history or diagnosis. That sounds pretty serious.
Yeah, that's right. 14 CFR Part 67 lists those 15 conditions, and they're all pretty significant. They include things like diabetes that requires medication, angina pectoris, which is chest pain caused by heart problems, a bunch of different heart conditions like coronary heart disease, history of a heart attack, heart valve replacement, having a pacemaker, even a heart transplant.
Wow, that's a lot. And then there are the mental health conditions, too.
Right. So any diagnosis of psychosis, bipolar disorder, severe personality disorders that have led to actual problems, substance dependence or abuse, including alcohol, epilepsy, any unexplained loss of consciousness or loss of control, those are all considered disqualifying. And you can see why. A lot of these conditions could potentially lead to a sudden incapacitation in flight, which is obviously a huge safety risk.
And that list, it's not even everything, right? There are other conditions that might require additional review by the FAA.
Yeah, that's really important to remember. The 15 conditions listed in that regulation are specifically disqualifying by history or diagnosis. But the FAA can also look at any other medical condition that might affect flight safety. So that could include things like cancer, kidney stones, neurological disorders like Parkinson's or MS, blood disorders, anything that could potentially get worse over time.
It was not a black and white situation.
Exactly. And the good news is that even if you have a condition that's normally disqualifying, there's still a chance you can get a medical certificate. That's where the special issuance authorization comes in.
Yeah, I was going to ask about that.
So basically, if you have a disqualifying condition, but you can provide the FAA with enough medical documentation to show that your condition is stable and it's not going to affect your ability to fly safely, they might issue you a special issuance authorization. It's basically a waiver that lets you fly even though you don't meet the standard medical requirements.
So there's hope.
Exactly. 14 CFR 67.401 outlines that whole process. It lets the FAA Federal Air Surgeon use their judgment to issue medical certificates even if there's a disqualifying condition. But the key is that you have to provide really good medical evidence to show that your condition is under control and that it won't pose a risk to flight safety.
That makes a lot of sense. Okay, so let's shift gears a little bit and talk about some of the health and physiological factors that can impact a pilot's performance during a flight. This seems like the kind of stuff where knowing the risks can really make a difference in staying safe.
It really is. You know, we've talked about the medical certification process, but now let's talk about what can actually happen to your body while you're up in the air. And one of the biggest things to be aware of is hypoxia.
Right, hypoxia, basically not enough oxygen.
Yep. And the brain is really sensitive to a lack of oxygen. So hypoxia can affect your thinking, your judgment, your coordination, basically all the things you need to fly safely. And what a lot of people don't realize is that there are actually different types of hypoxia.
Oh, really? Like different ways you can end up with not enough oxygen.
Exactly. So there's hypoxia, which is kind of the classic one that people think about. It's when there's just not enough oxygen in the air you're breathing. This happens at high altitude because even though the percentage of oxygen in the atmosphere stays the same, the air pressure gets lower as you go up. So there are actually fewer oxygen molecules in each breath you take.
Right, and that's why you need supplemental oxygen at higher altitudes. You just can't get enough from the air alone.
Exactly. And your source material actually has a really interesting figure 17:1, that shows how the time of useful consciousness decreases dramatically as you go up in altitude. Basically, it shows how much time you have to think clearly and act appropriately when you're deprived of oxygen. At really high altitudes, we're talking about seconds.
That's scary.
It is. And that's why understanding the effects of hypoxia and knowing how to prevent it is so important.
So what about those other types of hypoxia?
Right. So there's hypemic hypoxia, which is when your blood isn't able to carry enough oxygen, even if there's plenty of oxygen in the air.
So it's a problem with the blood itself.
Right. And there are a few different things that can cause this. One is a reduction in blood volume, like if you've lost a lot of blood from an injury. Another is anemia, which is a condition where your blood doesn't have enough red blood cells to carry oxygen. But one of the most common causes of hyperemic hypoxia in aviation is carbon monoxide poisoning.
Oh, right. Carbon monoxide. That's the silent killer.
Yeah, it's really dangerous because you can't see it or smell it. And we'll talk more about that later. But basically, carbon monoxide binds to the hemoglobin in your blood way more easily than oxygen does. So it basically takes the place of oxygen, and your body can't get the oxygen it needs.
So even though you're breathing, your blood's not delivering enough oxygen to your cells That's really scary.
It is. And even something as simple as donating blood can temporarily reduce your blood volume and make you more susceptible to hyperthermic hypoxia, especially at higher altitudes.
Okay, so we've got hypoxic hypoxia and hyperemic hypoxia. What's next?
Right. The next type is stagnant hypoxia, which is when the oxygen-rich blood isn't flowing to your tissues properly.
So the oxygen's there, but it's not getting where it needs to go.
Exactly. This can happen for a bunch of reasons, like if you go into shock, if you have heart failure, or if you have an artery that's blocked. But in aviation, it can also happen if you're exposed to excessive G-forces, like during aerobatic maneuvers. Those G-forces can restrict blood flow to your brain and other vital organs.
Oh, wow. I'm sorry about that.
Yeah, and even being exposed to really cold temperatures can cause stagnant hypoxia, especially in your extremities. That's why it's important to dress warmly when you're flying, especially at high altitudes.
Okay, and then there's that last type of hypoxia.
Right, histotoxic hypoxia. This is when your cells are actually unable to use the oxygen that's being delivered to them. And one of the biggest culprits here is alcohol.
Oh, interesting. So it's not that there's not enough oxygen getting to your cells, it's that your cells can't process it properly.
Exactly. Alcohol basically interferes with the ability of your cells to use oxygen for energy production. And other drugs can do this too, like narcotics and certain poisons.
So even if your blood is saturated with oxygen, your cells can't use it if you've been drinking or taking certain drugs.
Right. And it doesn't take much alcohol to have an effect. Your source material says that just 1 ounce of alcohol can have the same physiological effect as increasing your altitude by 2,000 feet.
So even if you're flying at a relatively low altitude, drinking can make your body think it's much higher up.
Exactly. And that's why it's so important to avoid alcohol before and during flight. It's just not worth the risk.
Okay, so with all these different types of hypoxia, what are some of the symptoms that pilots should be looking out for?
Yeah, that's a good question. Early symptoms of hypoxia can be pretty subtle and kind of sneak up on you. You might feel lightheaded, dizzy, or euphoric. You might have a headache, or your vision might start to get blurry. As it gets worse, your judgment and decision-making will be impaired, and you might start to feel tingly or numb in your extremities. And eventually, you could lose consciousness.
So it sounds like it can be kind of hard to recognize hypoxia in the early stages.
Yeah, it can be, and that's one of the dangerous things about it. You might not realize you're hypoxic until it's too late. That's why it's important to be aware of the risks and to take steps to prevent hypoxia, like using supplemental oxygen at high altitudes. And if you start to feel any of those symptoms, even if you're not sure it's hypoxia, the best thing to do is to descend to a lower altitude and always use supplemental oxygen if you have it.
Okay, good advice. So let's move on to another physiological factor that can affect pilots, hyperventilation. It seems like hyperventilation is kind of the opposite of hypoxia, right? You're breathing too much instead of not enough.
Right, but the tricky thing is that the symptoms of hyperventilation can actually be pretty similar to the symptoms of hypoxia, so it can be hard to tell them apart sometimes.
Oh, really? So how do you know if you're hyperventilating or if you're hypoxic?
Well, with hyperventilation, you're basically breathing out too much carbon dioxide, which can lead to a bunch of weird symptoms. You might feel lightheaded, dizzy, or tingly. Your vision might get blurry, or you might even faint. You might also feel like you can't get enough air, even though you're breathing really fast.
So some of those symptoms are similar to hypoxia, but it sounds like there are some key differences too, like that feeling of not being able to get enough air. That's not something you typically see with hypoxia.
Yeah, that's a good point. And hyperventilation is usually triggered by anxiety or stress. So if you're feeling really anxious or stressed out and you start to experience those symptoms, there's a good chance you're hyperventilating.
So what do you do if you're hyperventilating?
The main thing is to try to slow down your breathing. One way to do this is to breathe into a paper bag for a few minutes. This helps you rebreathe some of the carbon dioxide you've been breathing out, which can help to restore the balance in your blood. Another technique is to just focus on taking slow, deep breaths. And talking aloud can help too. It forces you to breathe more slowly and regularly.
Okay, that makes sense. And it's important to remember that hyperventilation is usually a temporary condition, and it rarely leads to serious problems. But it can be really scary when it happens, and it can definitely interfere with your ability to fly safely. So it's important to recognize the symptoms and know what to do.
I agree. Being able to recognize the signs and symptoms and having a plan for dealing with those situations is really important.
Okay, let's move on to another common issue that I know I've definitely experienced. Ear and sinus problems caused by changes in air pressure during flight. That can be really uncomfortable, especially during descents.
Yeah, it definitely can be. It all comes down to your body's ability to equalize the pressure between the air outside your body and the air trapped in certain cavities, like your middle ear and your sinuses. During climbs and descents, the air pressure in the cabin is constantly changing, and if your body can't keep up with those changes, it can cause a lot of discomfort and even pain.
Right. And the middle ear is connected to the back of your throat by the eustachian tube, which normally opens when you swallow or yawn. This helps to equalize the pressure. But it seems like during descent, it can be harder for that tube to open.
Yeah, exactly. As the cabin pressure increases during descent, the air pressure in your middle ear becomes lower than the pressure outside. This can cause your eardrum to bulge inward, which can be really painful. And sometimes that pressure difference can actually cause the eustachian tube to close up, making it even harder to equalize the pressure.
So what can you do to help your ears pop?
Well, there are a few things you can try. One is to swallow frequently, yawn, or chew gum. This can help to open up the eustachian tube. Another technique is the Valsalva maneuver, where you pinch your nose closed, close your mouth, and gently try to exhale. This forces air up the eustachian tube and can help to equalize the pressure.
I've definitely done that before. And it usually works, but sometimes it can be really hard to get those ears to pop. And your source material mentions that it's even worse if you have a cold or an ear infection.
Yeah, that's right. If you have any kind of congestion in your sinuses or eustachian tube, it can make it really hard to equalize the pressure. So it's best to avoid flying if you're sick. And if you do have to fly, you might want to talk to your doctor about using nasal decongestant sprays or oral decongestants. But it's important to use those medications with caution because some of them can have side effects that could affect your ability to fly safely.
Right. So always consult with an AME or your doctor before taking any medication, especially before flying. What about sinus problems? It seems like that's another common issue for pilots.
Yeah, sinus problems are also related to pressure changes during flight. Your sinuses are air-filled cavities in your skull, and they're connected to your nasal passages by small openings. Normally, those openings allow the pressure in your sinuses to equalize with the pressure outside. But if those openings get blocked, like if you have a cold or allergies, the pressure can build up in your sinuses and cause pain.
And it sounds like it's usually worse during descent, just like with ear problems.
Yeah, that's right. As the cabin pressure increases during descent, the pressure in your sinuses can become much higher than the pressure outside. This can cause a lot of pain, especially in your forehead and cheeks. And sometimes it can even feel like a toothache.
Oh, that sounds awful.
It's not fun. And the best way to prevent sinus problems is to avoid flying when you're sick or if you know you have allergies that could cause congestion. Decongestant sprays can sometimes help to open up the sinus passages, but oral decongestants can have side effects. So again, it's best to talk to your doctor before using them.
Okay, so we've talked about some of the more common physiological issues that pilots might experience. Let's move on to something that's a little more, spooky. Spatial disorientation. That's when your senses basically lie to you about where you are in space.
Yes, spatial disorientation is a really interesting phenomenon. It's all about how our brains process information from our different senses, like our inner ear, which gives us our sense of balance, our eyes, which give us our sense of sight, and our proprioceptive system, which tells us where our body is in space. Normally, all those senses work together to give us an accurate picture of our surroundings, but in flight, especially in instrument conditions or at night, those senses can get conflicting information, and that can lead to some pretty wild illusions.
Right. And it seems like our vision is usually the most dominant sense. So as long as we can see the horizon or other visual references, we're usually okay. But when we lose those visual cues, that's when things can get really disorienting.
Exactly. In visual meteorological conditions, or VMC, when we can see the ground and the horizon, our brains are pretty good at interpreting the information from our senses and figuring out where we are. But in instrument meteorological conditions, or IMC, when we can't see those visual references, our other senses start to take over. And unfortunately, those senses aren't always as reliable, especially in the unique environment of flight.
Right. So it's like our brains are used to operating on the ground, where gravity is a constant force pulling us down.
Yeah.
But in flight, we're constantly experiencing changes in acceleration and gravity, which can really mess with our sense of balance.
Exactly. And that's where those illusions come in.
So let's talk about some of those illusions. The first one that comes to mind is the leans. I've heard about that one.
Yeah, the leans is a classic. It usually happens after you've been in a turn for a while and then level the wings. Even though the airplane is no longer turning, your inner ear might still be sending signals to your brain that you're still turning. So you feel like you're leaning in the opposite direction of the turn. That's so weird. So even though you're flying straight and level, you feel like you're banked.
Exactly. And it can be a really strong sensation. You might even feel like you need to lean your body to compensate, which could actually make the situation worse.
Yikes. So what can you do if you experience the leans?
The best thing is to trust your instruments. Even if you feel like you're leaning, if your instruments are telling you that you're level, then you're level. It takes some mental discipline to override those false sensations from your inner ear, but that's what you have to do to stay safe.
Trust the instruments. That's a good rule of thumb for a lot of these illusions.
Definitely. Okay, so another common illusion is the Coriolis illusion. This one's a little more complicated, but basically it happens when you move your head in a different plane of motion while you're in a turn.
Like if you're looking down at your chart or reaching for something in the back seat. Exactly. So if you're in a prolonged turn, the fluid in your inner ear will eventually stabilize. But when you move your head quickly in a different direction, it can re-stimulate the fluid in a different part of your inner ear. And that can create a really powerful and disorienting sensation that the airplane is turning or accelerating in a completely different direction than it actually is.
So it's like a double whammy of disorientation.
Yeah, pretty much. And the Coriolis illusion can be really dangerous because it can lead to sudden and inappropriate control inputs. You might jerk the controls in the wrong direction, trying to correct for a movement that isn't actually happening.
So the lesson here is to avoid making any sudden head movements in the cockpit, especially when you're in instrument conditions or at night.
Absolutely. Smooth and deliberate movements are key.
Okay, what about the graveyard spiral? That one sounds particularly ominous.
Yeah, the graveyard spiral is a classic example of how spatial disorientation can lead to a fatal accident. It usually starts with a prolonged turn, where the pilot eventually loses the sensation of turning, kind of like with the leans. But in this case, the pilot might not realize they're still in a turn, and they might start to descend without realizing it.
So they think they're flying straight and level, but they're actually in a descending spiral.
Exactly. And because they're descending, they might pull back on the controls to try to gain altitude. But that just tightens the spiral and makes them descend even faster.
And if they're in instrument conditions and they're not paying attention to their instruments, they might not even realize what's happening until it's too late.
That's the real danger of spatial disorientation. It can sneak up on you, and if you're not aware of the risks and you're not actively monitoring your instruments, it can be really easy to get yourself into a dangerous situation without even realizing it.
Okay, so we've talked about the leans, the Coriolis illusion, and the graveyard spiral. What are some other illusions that pilots need to be aware of?
Well, there's the somatographic illusion, which is related to rapid acceleration or deceleration. For example, during takeoff, when the airplane is accelerating quickly, you might get a false sensation that the nose is pitching up. So you might instinctively push the nose down, which could actually cause you to hit the ground.
Oh, wow. And the opposite could happen during a rapid deceleration, right?
Yeah.
Might feel like the nose is pitching down and pull back on the controls, which could lead to a stall.
Exactly. Then there's the inversion illusion, which can happen when you abruptly level off from a climb. You might get a sensation that you're tumbling backwards, even though you're actually flying straight and level.
And the elevator illusion, which can happen during updrafts or downdrafts. You might feel like you're climbing or descending when you're actually not.
Right. There are a lot of different illusions that can happen in flight, and they can all be really disorienting. But the good news is that most of them are predictable and preventable.
So how can pilots prevent these illusions from happening?
Well, the first step is awareness. Just knowing that these illusions exist and understanding how they work is a big help. Then it's all about training and practice. Learning how to interpret your instruments correctly and developing a strong cross-check habit is essential. And there are also certain things you can do to minimize your susceptibility to spatial disorientation, like getting enough rest, staying hydrated, and avoiding alcohol and caffeine before flying.
And the source material also mentions that it can be helpful to actually experience some of these illusions in a controlled environment, like with a flight instructor.
Yeah, that can be a really valuable learning experience. There are certain maneuvers that instructors can do to safely induce some of these illusions so you can get a feel for what they're like and learn how to recognize them.
So you can kind of inoculate yourself against them.
Exactly. The more familiar you are with these illusions, the less likely you are to be fooled by them if you encounter them in flight.
Okay, so that's spatial disorientation. Let's move on to another category of illusions that can affect pilots. Optical illusions. These seem to be more related to visual perception, like how we see the runway during landing.
Right. Optical illusions are all about how our brains interpret visual information. And just like with spatial disorientation, there are certain situations in flight that can make us see things that aren't actually there, or that make us misjudge distances and heights.
So, like those runway with illusions, I've heard that if you're landing on a runway that's narrower than what you're used to, it can make you think you're higher than you actually are.
Exactly. And that can lead to a lower than normal approach, which could be dangerous. Conversely, if you're landing on a runway that's wider than what you're used to, it can make you think you're lower than you actually are, which could lead to a higher than normal approach and a harder landing.
And the slope of the runway can also play tricks on our eyes.
Right. Yeah. An upsloping runway can make you think you're higher than you are, and a downsloping runway can make you think you're lower than you are. And then there's the featureless terrain illusion, which can happen when you're flying over water or snow at night. It can be really hard to judge your height and distance in those situations because there are no visual cues to give you a sense of perspective.
Right, like that black hole effect that pilots talk about.
Exactly. And then there are weather conditions that can create optical illusions like haze, fog, and rain. Haze can make objects appear farther away and higher than they actually are. Fog can make it hard to see the runway, and it can even make you think you're pitching up when you're not. And rain on the windscreen can distort your vision and make it hard to judge distances.
And even the ground lighting can create illusions.
Yeah, like if you're flying at night and you see a line of lights that you think is the runway, but it's actually a road or a train track. Or if the runway lighting is really bright and the surrounding area is dark, it can make the runway look closer than it actually is.
So there are a lot of different ways that our eyes can deceive us in flight.
Absolutely. And just like with spatial disorientation, the best way to avoid these optical illusions is to be aware of them and to train yourself to recognize them.
So trust your instruments, cross-check your altitude and airspeed, and don't be afraid to go around if you're not sure about your approach.
That's great advice. And one more thing I want to mention about optical illusions is that they can be especially dangerous during the landing phase of flight. That's when you're transitioning from instrument flight to visual flight, and your brain is trying to make sense of all the different cues it's receiving.
So it's like a period of heightened vulnerability.
Yeah, exactly. So it's important to be extra vigilant during that transition and to really focus on maintaining a stable approach and a smooth landing.
Okay, so we've talked about spatial disorientation and optical illusions. Let's move on to a couple more physiological factors that can affect pilots. Motion sickness and carbon monoxide poisoning. Motion sickness or air sickness is something that a lot of people experience, especially when they're first starting to fly.
Yeah, it's really common. And it happens because the motion of the airplane can conflict with the information your brain is getting from your inner ear, your eyes, and your other senses. It's basically a sensory mismatch that can lead to nausea, dizziness, and vomiting.
And it seems like some people are more susceptible to motion sickness than others.
That's right. And it can also be worse in certain situations, like in turbulence or during aerobatic maneuvers.
So what can you do if you're prone to motion sickness?
Well, there are a few things that can help. One is to try to keep your head still and focus on a distant object, like the horizon. This can help to reduce the sensory conflict that's causing the motion sickness. Another thing that can help is to get some fresh air. Opening a vent or window can make a big difference, and some people find that eating ginger or taking over-the-counter motion sickness medication can help.
Right. But it's important to check with your doctor before taking any medication, especially before flying.
Absolutely. Some medications can have side effects that could impair your ability to fly safely. Okay, so let's talk about carbon monoxide poisoning. This is a really serious issue that can happen in any airplane with a piston engine.
Right. Carbon monoxide, that's the odorless, colorless gas that can be deadly.
Exactly. And it's a byproduct of combustion, so any engine that burns fuel can produce carbon monoxide. And the danger is that it's really hard to detect. You can't see it or smell it, so you might not even know you're being exposed to it.
And how does carbon monoxide actually affect the body?
Well, it basically prevents your blood from carrying oxygen. Hemoglobin, which is the protein in your blood that carries oxygen, has a much higher affinity for carbon monoxide than it does for oxygen. So if you're breathing air that contains carbon monoxide, it will bind to your hemoglobin and prevent it from carrying oxygen to your tissues.
So even if you're breathing normally, you could be suffocating from the inside out.
That's a good way to put it. And the symptoms of carbon monoxide poisoning can be very subtle at first. You might feel a little tired or lightheaded. You might have a headache or get nauseous. But as the exposure continues, the symptoms will get worse. You might start to feel confused, disoriented, or weak, and eventually you could lose consciousness and even die.
That's terrifying.
It is, and the scary thing is that it can happen really quickly, especially in an airplane. The ventilation systems in most airplanes aren't perfect, so if there's a leak in the exhaust system, carbon monoxide can build up in the cabin really fast.
So what can pilots do to protect themselves from carbon monoxide poisoning?
The best thing is to be aware of the risks and to take steps to prevent exposure. One of the most important things is to make sure your airplane's exhaust system is in good condition. Have it inspected regularly by a qualified mechanic. And if you ever smell exhaust fumes in the cockpit, that's a huge red flag. You need to land immediately and get the airplane checked out.
So if in doubt, land. That's a good rule of thumb for a lot of things in aviation.
Absolutely. And another thing you can do is to install a carbon monoxide detector in your airplane.